Hello and a very warm welcome to everybody joining me for another installment of Inside SA Media, which is proudly brought to you by Tribox Media and Fact Fort. My name is Lungi Sunyakyowa Onacha. Absolutely thrilled to be doing this with you one more time. Let's get into it. In the early 2000s, millions of lives were at stake. And the public debate about HIV basically meant life or death. And this wasn't just a medical crisis, it was also a media crisis. At the highest levels of government, denialism and misinformation were colliding with journalism and grassroots activism. This is the story of how media coverage changed the course of South Africa's fight against HIV. In 1999, newly elected President Thabo Mbeki stunned observers by questioning whether HIV actually causes AIDS. He cited uncertainty in the scientific consensus and framed his views as resistance to Western domination, arguing that Africans should not blindly accept the prescriptions of global pharmaceutical corporations. Some scholars suggest he was motivated by a genuine mistrust of the medical establishment, which is rooted in a colonial history of exploitation and unequal power.
But I personally thought that I wanted to understand this matter better. Now, as I've said, I'm only a fool. So now I've got all this difficult problem of reading all these complicated things that you scientists write about. It's language I don't understand. And I'm somewhat embarrassed to say that I discovered that there'd been a controversy around these matters for quite some time. I honestly didn't know. That perhaps I should have allowed the wise men to speak, because I'm a fool. Because indeed, when eminent scientists said, you have spoken out of turn, it was difficult not to think that indeed one was a fool. But I'm no longer so sure about that, given that so many eminent people responded to the invitation of a fool to come to this important meeting.
Alongside him, Health Minister Manto Tshabalala-Msimang publicly promoted garlic, beetroot, lemon, African potato, and olive oils as treatments, while describing antiretrovirals as these dangerous poisons. She once declared that raw garlic and a skin of lemon protect you from disease. These positions were deeply influenced by that anti-colonial framing. They reflected that mistrust of the multinational drug companies and skepticism of global health agendas, which Thabo Mbeki and his allies saw as extensions of imperialism. Yet the consequences were devastating, because between 2000 and 2005, Harvard researchers estimated that more than 330,000 people died prematurely. Over 35,000 babies were born with HIV needlessly because their mothers were denied access to antiretroviral medication. Critics argued that Mbeki's stance represented a misinterpretation of fringe scientific opinions. He favored a handful of dissenting voices over the overwhelming evidence. Others view it as a political assertion of sovereignty in the face of global inequality. Whatever the motivation, the result was catastrophic. Researchers have called his policy a tragic detour for a nation already ravaged by AIDS. Against this backdrop, South African activists and scientists responded forcefully. In 2000, the Durban Declaration, which was signed by more than 5,000 researchers, unequivocally reaffirmed HIV does in fact cause AIDS. Published in Nature, it described the evidence as clear-cut, exhaustive, and unambiguous. The media elevated this declaration, giving it both global and local reach, which of course challenged the denialism with science. South Africa's Treatment Action Campaign, which is better known as the TAC, led a grassroots revolt. Protesters wore bold HIV-positive t-shirts. They marched on Parliament, and they forced the story into the news cycle day after day. Journalists amplified their fight because we saw newspapers run human stories of parents losing children, and scientists warned of preventable deaths, and international voices condemned South Africa's government. And beyond that, the media gave the Durban Declaration global reach, countering Thabo Mbeki's narrative. The coverage grew louder, it grew sharper, and it was impossible to ignore. Eventually, activism and media pressure reached the courts because in 2002, the Treatment Action Campaign sued the government, demanding that it provide antiretroviral drugs to pregnant women to stop mother-to-child transmission. The Constitutional Court ruled in TAC's favor. Media coverage turned this victory into a national headline, basically shaming the state into action. International pressure also mounted. UNICEF, global NGOs, and foreign governments urged South Africa to change course. By 2005, a full antiretroviral rollout began. It came far too late for hundreds of thousands, but the tide had finally turned, and the lesson was clear here, that the power of the media and activism had forced policy to shift. The HIV story wasn't told in newsrooms only. Innovative campaigns carried the message where newspapers and press conferences couldn't reach. In rural villages, we had puppet shows like Puppets Against AIDS, which taught communities about prevention. On television, we had shows like Soul City and Generations, which weaved HIV storylines into their drama, sparking conversation in our households that we might have never read about in newspapers.
I left her.
How?
I went for an HIV test.
Easy for him to
And of course, even football joined the fight, because during Premier League broadcasts across Africa, we saw public service ads that shared HIV awareness messages. Through theatre, entertainment, and sport, HIV education became cultural, making prevention and treatment a little bit more personal, bringing it home. Denialism eventually faded, but of course, new challenges arose. In 2025, cuts to US-funded HIV programs threatened medication supply in South Africa, reigniting the fears of a treatment gap. Meanwhile, misinformation also persists. False cures on social media, conspiracy theories about vaccine, and of course fatigue amongst a younger generation in South Africa who never saw the worst days of the epidemic. The role of today's media is no less urgent. It continues to be urgent. It continues to need for us to spotlight the funding shortfalls, to highlight youth prevention campaigns, and to keep HIV on the public agenda. The battle for truth continues. In South Africa, media didn't just report on HIV. It literally changed its trajectory. Government denialism cost hundreds of thousands of lives, but relentless journalism, courageous activism, and creative campaigns turned the tide. The story of HIV continues to remind us that media doesn't only inform, sometimes it defends life itself. Thank you so very much for joining me for today's installment of Inside SA Media, where we broke down the story of HIV/AIDS and the media in South Africa. I certainly hope that you enjoyed that episode and that it inspired something in you, sparked a thought, or reminded you of the importance of fighting and defending life itself. From myself, on a chair, it is goodbye.